Hi, friends. Welcome back to VTube, your favorite channel where we talk about technologies which is related to many domains. We have talked about fashion, we have talked about DevOps, and we have talked about many other areas. Today, we welcome Dr. Pawan Rawal, who has 20 plus years of experience in specialized healthcare. He's a senior director in gastroenterology in India's one of the best private hospitals, Medanta, the Medicity, Gurgaon. Dr. Pawan has received many honors and awards for his research and services and has always been a frontrunner in leveraging the right technology and innovation. Dr. Pawan is a renowned public speaker and a regular vlogger for his best healthcare tips. We are going to talk technology and innovation, which is complementing, which is helping healthcare.
Thank you, Narendra. Thanks so much for having me here. So, I am Dr. Pawan Rawal. I'm right now Senior Director of Gastroenterology at Medanta Hospital, Gurgaon. Trained from institute called PGI Chandigarh, which is, of course, in Chandigarh. After that, I came to Gurgaon in 2010, and since then, I've been working over here, gradually promoted to the level that I am. Thank you again for having me here.
Thank you, Dr. Pawan. Uh, this is first kind of an episode where we are talking about healthcare complemented with the technology. So, as you have spent over 20 years into healthcare and you have seen this journey going from very basic to very advanced level, now where we stand. So, can you please put some light uh, with of that journey where you have seen things growing in this specific segment?
I think it's a great question. And, I've seen medicine evolving from exactly a clinical branch to a very high technology branch as of now. Especially in the field I belong to, the gastroenterology and intervention endoscopy has actually proven this very, very nicely. We were, I graduated from Rohtak and then I went to PGI Chandigarh. Of course, we were actually forced to become a very great clinician by asking histories, examination, and then making diagnosis. But believe me, complementing with this, the technology has actually added the actual spices to this. Complementing, I would say that once you have a good clinician in hand, and then you give him good technology in the form of diagnostics, which we know there are hundreds of diagnostic things are available. Great number of MRIs, CTs, technology has come up, PET CTs have come up. In my field, the endoscopy has gone to a next level. I mean, the era was there when we were not able to reach even stomach, and now we reach whole of the intestine with a capsule endoscopy. Believe me, so that has actually added to the good diagnosis. We still say become a good clinician. You ask histories, but then of course learning the technology has added. This is number one. Second, it has added to the management also. The way we used to manage the diseases. Let me exemplify. Once the patient was encountered in the OPD and then you make a diagnosis, then you do surgeries and you endoscopies. That time the hospital stays were too big. You were doing open surgeries and open procedures. Right now things are so minimally invasive. The things have reduced to a level where people don't stay in hospital more than 2 days. The hospital stays have come down, the number of ICU stays have come down, the miseries have come down. So it's a great thing to have good technology and actually complementing the real healthcare we see this era.
Great, Dr. Pawan. Uh, Today, when we see everybody is talking about artificial intelligence, various formats of artificial intelligence, and as uh, this series is all about like technology and innovation, so I would like to ask how artificial intelligence is actually helping in healthcare. Can you? There may be multiple ways, but I would like you to please highlight that specific area which you have experienced and you would like to share with us.
Yeah, so we are not far behind. I mean, healthcare is equally benefited by AI as other fields are. And let me start. I mean, it starts from the patient being actually faced in OPD. Once you send in for diagnostic, AI has added to the diagnosis. Suppose a person is being sent for either a CT or MRI or some kind of radiological technique, or the person is going for endoscopy, the AI helps in exact diagnosis. It has increased the accuracy of the radiologist on that end and endoscopist on the other end. And we find the smaller things in a very nicer way these days. One. Second, AI is actually contributing to decrease the time in the management of the patients. Like all the procedures, all the SOPs, they are being shortened because the AI has come in. We are able to automate the systems. We are able to automate the outdoor practice. We are able to automate the IPD practices and of course the procedure. So I would summarize that AI has added to the accuracy. It has decreased the time we take for diagnosis, and of course it gives a good outcome by the helping in the management as well.
Thank you, Dr. Pawan. This answer is amazing. Now, when we are talking about technology and innovation, and especially in country like ours, where we have full of population and facilities and good experts are not present everywhere, in which I would really ask you that, I mean, how technology is helping you in bridging that gap.
Yeah, actually, yes. The answer I would say, in concise, the answer is yes. It's helping a lot. So we believe that a lot of population stays in periphery, the tier 2 cities and the villages and the towns. And we all believe that the number of specialists and super specialists in these areas are not that as we have centered around NCR and the metropolitan cities. So, but we have evolved with this term called telemedicine, though it was there previously as well, but it's quite effective now. Now, telemedicine means that a patient who is there in periphery, suppose it requires some super specialty care, that's being monitored and being guided by the people sitting across in this city with telemedicine. Not even that, even the diagnostic images, if they are done there, they can be very well brought here for second opinion and they can be answered to have a better accuracy in the diagnosis. Even more than that, AI has actually come in that as well. So type of images we were doing last maybe 10 years or decade or so, now they are less in number. They reach to us in a very precise way with less load, and they can be analyzed very fast with us these days. So in summary, the telemedicine has become more precise. It's reaching to more number of people, and we are able to guide those doctors, maybe the medical officers sitting across the primary health centers or secondary or tertiary. I mean, we are guiding them sitting over here and helping them in diagnosis by analyzing the images. So that of course has helped. Yeah.
So is it also saving your time?
Definitely. I mean, suppose previously we were covering 10 towns or 10 villages with one doctor. Now we can cover more than that, maybe 50 or 100 places with one center because of the technology, of course, and number of softwares and the number of techniques which have been brought up by the, of course, you guys, that has helped a lot in that. And I see a era where most of the town will be covered by the specialists sitting across the tier 1 cities. It's not far away. Maybe in next 5 years, so we'll have that.
Sure. So I would also like to add one solution which we also have is more like a twin of a doctor. So we all know that when patient talks to a doctor or maybe twin of a doctor, so he gets much relaxed and he gets the straight answers. Now we have incorporated that twin with the right knowledge of that doctor, and that's giving much accurate answers, and that's also saving a lot of time of the real physical doctor. So I think this adds a lot of value in both.
I believe so.
Yeah.
I believe so. The only point which I will just add over here, since it's a great thing you are doing, the only thing, but probably I will add is the individualized touch to the care. That probably need to be more precise, and I believe in next couple of years or more, you guys will come up more and more accuracy to the diagnosis and the managed by the clones, because some kind of issue that comes up where is a medical legal problem. So somebody has to be responsible.
True.
A clone cannot be responsible for that. That's for sure. So I think something has to be brought in to cover that, and that's yeah.
So I'm now coming to a very practical example. So we would like to hear from you any specific story of a patient where he could really find the right benefit of using technology and innovation by you.
There are hundreds of examples, but then let me quote one you asked. So like previously, we were not able to reach the deeper part of the intestines. You know, the intestines are very long. Small intestine is actually very long, and we did not have that much technology to reach. These days, we have measures to reach to that area. And I remember, I mean, couple of patients who were sent to us where they were bleeding and nobody could find the source of the bleeding, and they were life-threatening bleeding. Fortunately, with the evolution of capsule endoscopy, and we have a term called as push enteroscopy, where we can reach the intestine, we could find out the source and we could actually control the bleeding without surgery. That actually led to the survival of the patient. And this is one of the examples. We have n number of examples we have every day, but this is what I can quote today.
Amazing.
Yeah.
And this can be life-changing for so many people who are in pain.
Exactly.
And yes.
See, we are coming to era where the elderly population is increasing,
Right,
and
right.
more and more number of people are not very fit candidate for surgery.
Yeah.
They have either comorbidities or they have cardiac issues or something else which is prohibiting surgery in them.
Right.
So actually, this is the area, or they are the people where the technology actually plays a role. You do less invasive procedure and they then save their lives.
Thank you, Dr. Pawan.